Okay, let's talk about a plumbing crisis. But this isn't happening in your house. It's happening inside your body. We all have this incredibly complex system, and right at the center of it is the liver, our master filter. So, what happens when that filter gets clogged? We're about to look at a hidden and very dangerous pressure problem that can bring the whole system to a grinding halt.
You know, just imagine you're on the main freeway into a major city during rush hour, and boom, a total blockage. Traffic backs up for miles, pressure builds, tempers flare, it's chaos, right? Well, that's a perfect picture of what we're talking about with portal hypertension. It's a traffic jam in one of the most critical blood highways in your entire body.
So what is this thing really? Portal hypertension is just a fancy term for a serious pressure backup in the portal vein system. That's the network that carries all the blood from your gut to your liver to get cleaned. Now, when that pressure gets too high, we're talking 5 times the normal level, that's when it crosses a line and becomes really, really dangerous.
And it all boils down to some pretty simple physics. You don't need a degree to get this one. Pressure in any system, whether it's the pipes in your wall or the veins in your body, goes up for one of 2 reasons. Either you have way more flow, or, and this is almost always the culprit here, there's more resistance. Something is blocking the pipe. So if something's blocking the pipe, the big question is, what is it and where is it? Well, the problem almost always starts inside the filter itself, the liver. So let's take a look at how a perfectly healthy liver can transform into a high-resistance roadblock.
Just look at the difference here. It's night and day. A healthy liver is smooth, it's organized, blood just flows right through it, no problem. But then you look at a liver with cirrhosis, and wow, it's a total mess. It's scarred up, it's lumpy with these weird nodules, and the vessels themselves are squeezed tight. This damage usually comes from years of things like heavy drinking, viral hepatitis, or fatty liver disease. Trying to push blood through that? It's like trying to push water through a rock. It just ain't gonna happen easily.
And you know what happens when pressure builds up behind a clog, right? Eventually, the system starts to fail, and it can fail in some pretty catastrophic ways. The body, it's smart. It tries to create workarounds. But here's the ticker. Those workarounds can create their own set of deadly problems.
We're going to focus on 3 of the scariest complications. First, you've got varices. Think of these as weak, bulging pipes that are about to burst. Then you've got ascites, which is basically a massive internal flood. And finally, encephalopathy, which is a toxic backup that goes straight to the brain. And that first problem, the bursting pipes, the numbers here are just jaw-dropping. Roughly half, 50% of all patients with cirrhosis already have these fragile swollen veins when they are first diagnosed. The danger isn't on its way. It's already there, like a ticking time bomb.
So why do they burst? Well, the theory has a pretty dramatic name, the explosion hypothesis. And it's exactly what it sounds like. The pressure inside these veins just builds and builds, stretching the walls thinner and thinner until pop, like an overinflated balloon. When one of these ruptures, it is an absolute all-hands-on-deck medical emergency.
And the consequences are just brutal. For someone who has their very first bleed from one of these varices, the mortality rate can be as high as 35%. That's a staggering risk, so you can see why the absolute #1 priority is to prevent that first bleed from ever happening in the first place. All right, let's talk about that system-wide flood, ascites. The pressure inside the veins gets so high that fluid is literally squeezed out of the blood vessels and starts pooling in the abdomen. And we're not talking about a little bit of bloating. We're talking liters and liters of fluid, making it hard to even move or breathe. Plus, that fluid is a perfect breeding ground for some really nasty life-threatening infections. And finally, there's that toxic backup. Because blood can't get through the liver, the body creates those bypass routes we mentioned. The problem is that blood is bypassing the filter, so toxins like ammonia, which the liver would normally clean out, now have a straight shot to the brain. That's what we call hepatic encephalopathy, and it can cause anything from mild confusion all the way to a coma.
Okay, so the situation is obviously really serious. But here's the good news. Modern medicine has an incredible toolkit for this stuff. Doctors become expert plumbers, and they have some amazing ways to find and fix these leaks.
The game plan for dealing with bleeding varices is broken into 3 really logical stages. First, you've got primary prophylaxis. That's all about preventing that terrifying first bleed. If a bleed happens anyway, the team immediately switches to acute treatment, stopping the bleed right now. Then, once the crisis is over, the goal becomes secondary prophylaxis, making absolutely sure it never happens again.
So, how do they actually stop them? One of the most common tricks in the book is called endoscopic band ligation. It's actually pretty clever. A doctor snakes a tiny camera down the esophagus, finds those bulging veins, and then uses a tiny device to snap a little rubber band around the base of each one. It just chokes off the blood supply and the thread is gone. It's a direct mechanical fix, like clamping a leaky hose.
But sometimes patching the leaks just isn't enough, especially if the problem keeps coming back. In the really severe cases, you have to do something more radical. You have to reroute the flow completely. And this next procedure is a truly ingenious piece of medical engineering.
It's called TIPS. That's short for a real mouthful, transjugular intrahepatic portosystemic shunt. But what it boils down to is this. Doctors create a brand new channel, an internal bypass, that goes right through the middle of the clogged liver. This new tunnel connects the high-pressure incoming vein directly to a low-pressure outgoing vein, and the pressure just plummets.
And here's how they do it. Get this. All without major surgery. They go in through a vein in the neck, steer a catheter all the way down into the liver, and then, here's the wild part, they push a needle right through the liver tissue itself to create a tunnel to the portal vein. Then, they deploy a little metal mesh tube, called a stent, to prop that new tunnel open for good. It's just brilliant.
And the results speak for themselves. TIPS is way better at preventing another bleed than just banding them. We're talking about a 30% improvement. But there's a trade-off. By creating such a good bypass, you're also increasing the chance that those unfiltered toxins get to the brain, which means a higher risk of encephalopathy. It's a really delicate balancing act.
So all of these incredible treatments we've talked about, they're all designed to manage the complications, right? They're dealing with the pressure. But what about the root of the problem? What do you do when the filter itself is just too far gone?
At the end of the day, for someone with end-stage liver disease, there is only one true cure. You have to replace the failed filter entirely. A liver transplant. It swaps out the scarred, clogged-up organ for a healthy new one. And it solves the problem of portal hypertension once and for all. And that really brings us to the final, most important question, doesn't it? All of these amazing medical interventions are reactions to a crisis that's already in full swing. So it makes you wonder, how can we all do a better job of protecting our liver, this vital, silent workhorse, in the first place, long before the pressure ever gets a chance to build?